Good evening, everyone. Good afternoon, good morning, good day, basically, wherever you're watching us from. You're welcome to another episode of Ask the Pediatricians Live. And today it's going to be a special edition because we're focusing on pneumonia and diabetes. So, if you have concerns about pneumonia, do you have questions, you have something you want to learn that you don't understand, now it's the time to get your power packed episode on ATP Live. And today with me, I have Dr. Rotimi Adesanya. He is actually representing Dr. Gbemisola Boyede, who is unavoidably absent. But I can bet you that you are getting the same guarantees. I'm giving you the same guarantee that whatever we're learning from Dr. Boyede is what Dr. Rotimi is also going to teach us. So call your neighbors, call your sisters, call your friends, call your cousins. It's time to learn about pneumonia and diabetes. All your queries, all your concerns, Dr. Rotimi is available today to answer them. And also to tell you that aside pneumonia and diabetes, or your other child related questions will also be answered by our amazing Dr. Rotimi. So, Dr. Rotimi, good evening, sir. You have the floor.
Good evening to all our members, volunteers, our followers on all our platforms, the Facebook, the Instagram, the YouTube, the TikToks, all our followers. I want to say good evening to everyone. Today is actually World Diabetes Day, November 14th, every year is set aside as World Diabetes Day. We all know that diabetes cut across all age group from childhood, pregnant women, and adults, men, women, every other person. Diabetes cut across all the spectrum. Also, last Saturday was World Pneumonia Day, and World Pneumonia Day was celebrated worldwide last Saturday, November 12th. We be taking the two uh, topics together this evening. Then you can post your questions and follow us as my host lead this discussion this evening. Okay, can I go on, my host?
Yes, sir.
Okay, last Saturday, like I said, is World Pneumonia Day. November 12th every year set aside as World Pneumonia Day. And what is pneumonia? Pneumonia simply means chest infection in a layman's language, chest infection. And we all know that children are more exposed. Children are more at risk of having pneumonia. Many of the children, especially in developing world like Nigeria, normally die from pneumonia. That's why the day was set aside for pneumonia. November 12th, which was Saturday, I've said that pneumonia simply means chest infection, and pneumonia can be acquired from the environment. When children are exposed to passive smoking, maybe their parents are using firewood to cook, or somebody around is smoking, or somebody around is even coughing. Adults, children, young ones that are coughing. These are ways that children acquire pneumonia. And as a result, if it is not taken care well, such children, they die from pneumonia. And also, several strategies have been put in place to prevent pneumonia. We should also say, thank the government of the country. A lot of this immunization that prevents against pneumonia has been introduced to what we take. Immunization like HIV, that's Haemophilus influenza B vaccine has been introduced and is given free under the public sector. The pneumococcal vaccine also prevents against pneumonia. That has also been introduced to prevent our children from pneumonia. And we believe, very soon the prevalence of pneumonia in children in our environment will reduce. What are the signs and symptoms of pneumonia? If you see any child that has been coughing persistently, when you see the child, having fever, or you see the child is unable to eat, that's cough, fever, inability to eat. Then if you see the child with fast breathing or difficulty in breathing or rapid breathing or breathing that is noisy breathing, breathing that is making sound, these are the symptoms of pneumonia. Such children should be taken to the hospital, especially those that are in the infancy stage. Those that are less than 1 year, they should be taken to the hospital for doctors, to actually diagnose and treat them appropriately, because pneumonia can lead to complications, and some of these complications can also affect the heart, and we don't want our children to die from complications from pneumonia. Then in the hospital, there are tests that we do for pneumonia. We do tests like full blood count. We check the blood level of the children for infection. We have said that pneumonia is infection. We check the blood level for infection. We check the oxygen level in the hospital. We also do what we call chest X-ray, chest radiograph, to see the extent that pneumonia has gone to in children. So these are the basic tests your doctor may order to properly diagnose the children for pneumonia. After this, the next is management. How do we manage pneumonia? We have said that pneumonia, the children should not be exposed to passive smoking, like those that use firewood. They should take the children away in the village. This is common in the villages. Then those that smoke, they should not smoke where children are, because the children will be passive smokers. Then those that already have cough or infection, that are coughing, they should isolate themselves so that they don't infect our children. Or children that are already coughing too, they should go for treatment, and they should be separated for the time being so that they don't infect others. The truth is that pneumonia is contagious, is highly contagious, meaning that if a child has it, the other children can easily also have it. How do we treat pneumonia? Pneumonia is treated by giving antibiotics. Antibiotics is the main therapy in pneumonia. Some pneumonia that are complicated, doctors normally support with oxygen. When the pneumonia is severe, we support such children with oxygen as a supportive service. But the main treatment is antibiotics, which we give for a period of 5 to 14 days, depending on how the case is. Also, to prevent pneumonia, our children should be immunized, especially in the infancy period, against all the immunizations. Measles, I must tell you that measles also cause pneumonia. So they should take all the immunization: measles, pneumococcal vaccine, Haemophilus influenza B vaccines. They should take all the stages, all the 3 stages. The one that is given at 6 weeks, at 10 weeks, at 14 weeks. They should take all these vaccines so as to protect the children, from acquiring pneumonia. So these are the short thing I will say this evening about pneumonia before I move to diabetes, which will be what I will be dwelling more on this evening. Yes, like I said, November 14, which is today, is World Diabetes Day. It is dedicated worldwide as World Diabetes Day. It's a day that will sensitize the whole world, the public, the mothers, caregivers, about what diabetes is. What is diabetes? Diabetes is a metabolic disorder that is characterized by elevated blood sugar or blood glucose level. And this elevation normally leads to complications like damage to the eyes, damage to the kidney, damage to the liver, and damage to many other parts of the body. This is the definition of diabetes. You can see that it is all encompassing. I first said that diabetes is a metabolic disorder. That means diabetes has to do with food, has to do with what we take in, and also has to do with elevated blood sugar, high blood sugar, or high blood glucose. So, and it also causes injury to the eye. I must say at this junction that diabetes is one of the commonest causes of glaucoma and blindness. That's how diabetes affects the eye. Diabetes also, affect the kidney. Many of the patients that you see with kidney failure, Many of them may have diabetes. Diabetes also affect the heart. You know, in short, part of the complication, some that have bad severe diabetes mellitus, severe hyperglycemia, some of them may go into coma, they may be unconscious, and some of them, you know, they may slump or they may even die as a result of uncontrolled diabetes mellitus. We have two types of diabetes mellitus. One is called type 1 and the other is called type 2. What is type 1 diabetes mellitus? Type 1 diabetes mellitus is the type of diabetes that is acquired from childhood. It is genetic. The child acquired it from the parents. It is caused by the genetic predisposition of the child. It is acquired, you know, from childhood. So I'm sure you are not surprised that children do have diabetes. That is the one we call type 1. We also call it insulin-dependent diabetes mellitus. Insulin-dependent diabetes mellitus. One of the things that I didn't mention when I was defining diabetes is the place of insulin. Diabetes is normally as a result of insulin deficiency. Insulin is an hormone in the body. It is present in everyone, and it helps to control our blood sugar. When we eat, our blood sugar surge goes up. It is the insulin in us that helps us to control it. But in this type 1 diabetes, the insulin production is not there. The insulin production is deficient. And like I've said earlier, it is acquired from birth. You know, that's why we call it childhood diabetes mellitus, also called type 1, or also called insulin-dependent diabetes mellitus. And it has a genetic predisposition. That means it is acquired from the parents. Then we have what we call type 2 diabetes mellitus. Type 2 diabetes mellitus is actually what we call acquired diabetes. As we are growing up, people get diabetes. Some people, maybe at the age of 20, 30, 40, they were not diabetic, but they will now find out that later in life, at the age of 40, 50 or above, they are now diabetic. This is type 2. It's as a result of lifestyle, our lifestyle. Things like living sedentary life, which is inactivity, you know, things like obesity, when somebody is obese, these are what predisposes to one having type 2. Things like what we eat, eating junk food, you know, eating junk food. So this is also one of the things that causes type 2 diabetes mellitus. What happened in type 2 diabetes mellitus is actually the resistance to insulin. There is resistance to insulin from all the processes that are going on in the body. So I go back to the causes as I'm going. You can, our listeners, our members, our followers can send in their questions as I take we also answer the question as I'm going on with the topic. So the other causes of diabetes mellitus are some people that have pancreatic disease. There's an organ in the stomach, in the abdomen, that we call pancreas. So some people have disease of this pancreas. Pancreas is what is responsible for production of insulin. You know, we said earlier that insulin is what helps us to convert the glucose, to store it in our body, so that the glucose, the high glucose, will not be harmful to us. So some people, the pancreas is just defective, is diseased, or they may have a cancer of the pancreas. In such people, they may also have high glucose level. The other causes of diabetes is obesity or overweight, like we have said earlier. Some medications will also lead to diabetes mellitus. So these are just the common causes of diabetes mellitus. Like I said, it can be from genetic, which is acquired from the parent. It can be from lifestyle, obesity, overweight. It can be from medications that we take, or it can be from pancreatic diseases or pancreatic cancer. So these are the causes of diabetes mellitus. How do we diagnose diabetes? Yes, diagnosis of diabetes is actually by doing a blood sugar test. Blood sugar test. I'm sure all our listeners have heard of blood sugar test before, or blood glucose test. Blood sugar test can be done, as a fasting level, first thing in the morning, when the person has fasted overnight, meaning that the person will not take anything overnight for like 9 to 12 hours before doing the test. We call it fasting blood sugar. So if the test is done in the lab or at home with a small machine that we call glucometers, I must also say at this point that anyone that is diabetic is expected to have the glucometer at home. Even those that are not diabetic, they can also have glucometers at home to check their sugar level from time to time, to see the level they are and how they are doing. So if the fasting blood sugar is less than 100 milligram per DL, the person is said to be normal. The person is not diabetic. If it is between 100 and 125 milligram per DL, the person is said to have what we call pre-diabetes, or what we call impaired glucose tolerance. Then if it is more than 126 milligram per DL, it is the person is said to have pre-diabetes. Then if it is more than 125 milligram per DL, the person is said to have pre-diabetes. The person is said to farm the diabetes. Things like glycated hemoglobin, we still do this other test to confirm diabetes mellitus. So, like I have said, also there are other tests that we do. We do glycated hemoglobin. For our pregnant women, the obstetricians and gynecologists, we tell them to do what we call oral glucose tolerance tests. They'll be given glucose to take, and their sugar will be taken thereafter. Their sugar level will be checked thereafter. Also, at times in the laboratory, we also tell our patient to eat 2 hours after we check their sugar level again. This is called 2 hours postprandial test. So this one also has its level. At any point in time, the other glucose tolerance test that we do for our pregnant women and the 2 hours postprandial test to not be more than 180 at any point in time. If it is more than 180, diabetes mellitus is diagnosed in the person that is concerned. So I will quickly move to management of diabetes mellitus. Management of diabetes mellitus is a multidisciplinary, it involves multidisciplinary approach. This means that many specialists, many doctors, many specialists, many healthcare givers are involved in the treatment of diabetes. We have in the team, we have the dietitian, we have the family physician or the general practitioner who will diagnose the person. We have the endocrinologist or diabetologist, doctor that treat diabetes. You also have the pediatricians in case of childhood diabetes mellitus. Then we have dietitians. These are the people that advises on the type of diet and how to control. Then we have these specialists that we call podiatrists. Podiatrists are doctors or other healthcare workers that specializes in the management feet, of the feet, of our legs, because diabetes is a condition that affects the legs in a very bad way, which we still talk about under complication, what we call diabetic foot, whereby the foot or the feet of the person is getting gangrenous, is getting decayed. So we have special doctors for that. We call them podiatrists. They are also involved in the management, of diabetes mellitus. You can see that diabetes actually cuts across so many spectrum. Many specialists are involved in the treatment. Mind you, I said earlier, maybe I will mention that later. Then still talking about the management, we start by diet. We tell our patient the type of diet. We calculate the amount of diet that they needed to take, and we tell them the quantity of food that they need to take. We tell them the type of food that they need to take for snacking when they want to snack. A snack is the food that is eaten between meal. That means between breakfast and the lunch. You may feel hungry. You may want to take something. That is what we call snack. It's not meat pie. It's not burger. Snacks is what you eat between two meals, between your breakfast and the lunch. Your snacks could be garden egg. Your snacks could be apple. Your snacks could be watermelon. Your snacks could even be cucumbers. So that's what we advise our, patients these days, that when you are going to work, just put the fruit in your bag. That will be your snacks for the day, not meat pie, not sausage, not burger and all those things. They are not healthy diet. So
Not
diet,
chocolate.
hello?
I said not chocolates.
Yes, not chocolate, not biscuits, all those ones. They are not snack. They are not snacks. So we medics, the snacks are those other healthy fruits that you can put in your bag and you take during those periods. So I've just mentioned diet as a method of treatment of diabetes. Then we also have exercise. Exercise actually reduces blood sugar. The WHO advises us to do exercise 30 minutes in a day, 5 times in a week. The exercise, if you are not somebody that used to do exercise, you can start from just walking. Walking, from walking, you move to brisk walking, you can move to jogging, and so on and so forth. And some people can even take it further by registering in the gym so that they get regulated exercise. Through exercise, we can get our sugar level, control. Then moving from that, doctors also prescribe drugs for diabetes. We call them oral hypoglycemic drugs or oral hypoglycemic agents. These are drugs that help to reduce the blood sugar level. And for those that have type 1 diabetes, we said type 1 diabetes are those that acquire from childhood. Those ones are placed on insulin. We have said earlier that the problem has to do with insulin. So those ones are placed on insulin and they are controlled. And many of these are patients, we also educate them. We teach them how they are able to inject themselves, because somebody cannot be coming to the hospital every day to take insulin injection. So such children that are having childhood diabetes, they are given insulin, they are taught how to inject themselves, and this is also controlled. So also we have the pediatrics that I mentioned earlier, the people that take care of the feet, because one of the complications of diabetes is what we call diabetic foot. The foot, somebody, if they have wound on the legs, within few days, they can just get, the legs can get gangrenous. So then I miss the signs and the symptoms are, which is very important. Let me quickly go to the signs and the symptoms. For diabetes, the sign and symptom include excessive thirst, which we call polydipsia. The person is just thirsty, just wanting to drink water, just drinking water, drinking water. The person is just thirsty. So excessive thirst, which we call polydipsia, is one of the symptoms of diabetes mellitus. Then excessive eating, which we call polyphagia. The person just keep eating. The person can take like 5 square meals in a day. It's also a symptom of diabetes mellitus. Polyuria is a condition whereby the person will keep passing urine, just keep passing urine and passing urine. Excessive urination is also a symptom of diabetes. Also, nocturia, the person will have to wake up more than 3 or 4 times at night to go and pass urine, to use the convenience to pass urine. So that's also one of the symptoms of diabetes mellitus. We have other symptoms like blood vision. The person may not be able to see clearly. Other symptoms like weakness or extreme tiredness. These are people have tingling sensation on their hand. Yes, some may have like vibration in their hands or their legs. They have tingling sensation. They don't have sensation. They don't have feelings on their legs and their hands. It's also a symptom of diabetes. And as a result, many of our diabetic patients may mash on something that is sharp without knowing. They will have gotten know before they see that they are carrying wound, because there is no sensation there. So these are symptoms and signs of diabetes. Also in men, diabetes come with what we call ED, erectile dysfunction. So many men may not be able to achieve erection during sexual intercourse. It's also a symptom of diabetes mellitus for our men under the ATP family that are having erectile dysfunction, we encourage them to get their blood sugar level also checked. So these are the signs and symptoms of diabetes mellitus. Then we go to complications. The complications of diabetes are many, starting from the eye. So diabetes is a major cause of blindness worldwide. Diabetes is a risk factor for glaucoma, which ultimately leads to blindness. Diabetes, may also affect the hearing. Some patients experience tinnitus, ringing sensation in their ears. Diabetes is a risk factor for stroke. Diabetes affect our heart. It can be part of what is responsible for heart failure. Diabetes could also make the kidney to fail. Many of the patients that we see are having kidney failure, that are going for kidney transplant. Probably most of them is due to diabetes that they are having. Diabetes cause erectile dysfunction. We mentioned that earlier. Diabetes also lead to gangrenous feet. The legs will becoming decay, which we call diabetic feet. Is a major problem. And also in this part of the world, diabetes is the commonest cause of non-traumatic amputation. Is the commonest cause of amputation due to non-traumatic causes. What I'm saying in essence is that many patients that go to the hospital and they have their leg being amputated, apart from accident, diabetes is a major cause that makes doctors to say they want to amputate a patient's leg so that they can do better. Then diabetes could also lead to coma when it is too high. The person may slump, the person may even die from severe diabetes mellitus. These are the all we need to know about diabetes mellitus.
Wow. Thank you so much for that wonderful lecture. In fact, I've learned a lot today. I don't know, and I'm sure our viewers too, they've learned. So it is time to drop your questions and your concerns, anything you feel Dr. Rotimi has not touched for you, or probably you need a clarification. It's time to drop your questions now. So for the next few minutes before we call it a day, you have your time to drop your questions now. Now, I noticed something that we are unable to share directly to Facebook. So, what I did is I shared through my Facebook page, and also they asked the pediatricians Facebook page. So you can just
Okay.
go to the group, you will see both there, either mine, Olufemi Ajigbeu, Olufemi Khadijat Ajigbeu. You see that I shared it on the Facebook, and also through the Ask the Pediatricians Foundation official page. So it's being shared there. So you can drop your questions now, and Dr. Rotimi will answer them.
Yes, you can also help us to share on the ATP family group.
Okay, I think I should just.
Okay, while we are waiting for the questions, yes, well, diabetes is a condition that is preventable. I must say there is no cure. Diabetes does not have cure. What we do is that we manage diabetes. We manage it so that the person will not develop all these complications that I've been mentioning. So diabetes can be properly managed. If somebody is diagnosed, the person should take steps to see specialists, to see doctors, and see all the cadres, all the other people in the team that we mentioned for the management of the diabetes. It can be managed well so that the person can live long. Because truly, it is said by WHO's figures, 1.5 million people died every year from complications of diabetes mellitus worldwide. So you can see the number, the figure so high. And WHO is also figure also said that diabetes mellitus is also on the rise now. It is so high that we have over 400 million people worldwide with diabetes mellitus. So that's to tell us that this diabetes is increasing day by day. And you and I know the reasons why such are happening, because like sedentary life, these days compared to the days of our parents. Like if our parent, for example, they may have to trek. Let me use bank for example. They may have to trek to the bank to do transactions, trek to the post office to post letters, and all those things. But these days, you can post mails without even leaving your seat. You can do bank transactions on your seat. You can go to market, while indoor, online marketing. But our parents those days, they have to go from one market to the other, which is a form of exercise. They have to trek. But these days, all the marketing can be done in the comfort of our home. So this could also attribute to the increase we are seeing these days. Also, the Western food that we are used to now, the junk foods that we are eating now, those foods in the earlier days, some people may not be able to afford it. But thank God for good economy and the rest. People can now afford to buy food from the eateries and the rest. This also, all this contributes to the increase, the rise we are seeing in diabetes mellitus in the type 2, which we said is due to lifestyle.
Okay, I want to ask a question, me personally, and I'm sure I'm
Yeah.
asking for some of our viewers. Like someone that is diagnosed with diabetes now, how is it possible to manage it? Like, and the person is still taking alcohol, will the person have to stay away totally from alcohol, or maybe occasional drinking? There's stuff for a while, drink at a point, stuff for a while, or you have to stay away completely from alcohol.
Oh, yes, thank you very much. Under the prevention, I didn't mention that there are some things that one we need to quit from. And in this part of the world, we actually use the word quit to quit from such. Alcohol is one of the things. It will surprise you that alcohol actually has higher calorie than carbohydrate that we are running from. It has higher calorie than fat and oil that we are running from. So alcohol, those that have been diagnosed, you actually quit from alcohol intake because the calorie there is just too much for what the body will be able to process. It will be too much for the liver to be able to process it. It's a substance that have very high calorie, much more than the glucose that we are even trying to control. So people should quit alcohol. Even people that smoke, there is a linkage between smoking and diabetes mellitus. People that smoke are also advised to quit smoking in order to have their sugar well controlled.
Okay, okay. I hope I've helped some people ask a question. Probably you don't know how to put it together, so I'm sure I've helped someone ask a question. So we are waiting for questions. We still have time. We still have time, and Dr. Rotin is still available to answer our questions. So please, we are waiting.
Okay, yes, while we are waiting for the question, I think I will just continue.
Okay.
Okay, we can first go back to the pneumonia that we mentioned
Yeah. Okay.
earlier.
I think we already talked about
Yes,
it.
yes, yes, pneumonia is actually more of childhood disease, but adults do have pneumonia, but it's not as bad as when it happens to children. One of the major causes of infant mortality in Africa and developing countries, which Nigeria is an example, is pneumonia. Pneumonia is one of the things that is responsible for the increase in high mortality rate that we are having because children in this part of the world still die from complications of pneumonia. I mentioned earlier that they have complications like heart failure if the pneumonia is not properly treated. They have several complications like septicemia if the pneumonia is not properly treated. And in this part of the world, this is adding to the increase in infant mortality rate that we are having. And the government the public sector is actually trying with a donor agency some of the immunizations that parents may not be able to afford. like pneumococcal vaccine. The government are now putting it under the national program on immunization, for no fee. Then also Haemophilus influenza B vaccine, which also Haemophilus influenza also cause pneumonia, is also available under the national program on immunization. So so we encourage our mothers to make sure that their children, especially in the infancy stage, when they are less than 1 year, they get all these vaccines when they are less than 1 year, that all these vaccinations are taken so that they can be protected against these childhood killer diseases, which pneumonia is one of them. Very soon, we'll be saying bye-bye to pneumonia if everybody take the right thing that they need to do. Our parents, don't use firewood to cook. They don't expose the children to passive smoking, or those that are coughing, those that already have infection, the adults that are coughing, they go to hospital to get treated. Also breastfeeding, our mothers should do exclusive breastfeeding for the first 6 months. This also protects against pneumonia. Also vitamin supplementation. All this protect against pneumonia, because once the immunity is low, the children, they may have pneumonia. So, but when their immunity is boosted, they will not have pneumonia. So breastfeeding, exclusive breastfeeding, is one of the ways whereby our children can be spared from having pneumonia. So World Pneumonia Day, November 12th, every year is set aside to sensitize everybody, to sensitize the world. And I'm also mentioning some myths here. Number one, pneumonia is not caused by ice water, is not caused by cold water, is not caused by probably the AC is on or in a cool environment. If it is caused by a cool environment, that means everybody in the temperate region, like in the Western world, where the temperature is very cold, that means all their children will have pneumonia. So this is one of the things we should take home. It's not caused by the coldness of the environment. It's not caused by taking cold water. It's not caused by the person coming out in the air, because we have seen many of our parents, they will wear double layers for the children, after wearing the clothes, the second layer, the third layer. The pneumonia is not prevented in this way. Pneumonia is from the air that we breathe in. It's from the air that the children breathe in. So if there's a way we could make the air cleaner, then our children will be protected, not taking ice water, cold water. Also for the parents too, because some of our mothers do ask questions. Can they take ice water when they are breastfeeding? Can they take ice water when they are pregnant? Yes, they can actually take these things, provided their body goes with it, but they don't cause pneumonia in any way. You don't cure pneumonia by putting methylsalicylate like rub on somebody's chest. It does not have any significance. It comes from the head, not by putting rub or balm or any of this methylsalicylate on the chest. You can't prevent pneumonia through that way. And we also said that pneumonia comes with fever, comes with cough, comes with catarrh, it comes with fast breathing. So when you see a child with all these symptoms, that child is likely to have pneumonia, and that child should be taken to the hospital for diagnosis and for treatment. It's not the time to abuse antibiotics. It's not the time to say the child is having typhoid, like many people used to say, but it is the time to take the child to the hospital for the child to be diagnosed of pneumonia and to be treated. Pneumonia is treatable. Children that have pneumonia, once they are commenced on antibiotics for 5 to 14 days, as the case may be, they get well from this pneumonia. They get well and they are back on their feet. But some children that have severe pneumonia, they may have complications like heart failure. Those children need to be admitted in the hospital. They need to be put on oxygen. They need to be given drips. They need to be given the antibiotics as intravenous in order to get them out of the infection. Then our children that are in the infancy period, especially those that are less than 6 months, if they are having pneumonia, such children should be taken to the hospital If they are having pneumonia and the pneumonia is confirmed, they may also be admitted by the doctor in order for them not to have complication, because this is a very vital period in the life of children, that are growing. So these are what we need to do about pneumonia. This is how we have to get around pneumonia. So very soon, we'll be able to have pneumonia-free world, pneumonia-free environment.
Okay, another question now. Do we need to isolate children that has pneumonia from other children? Like maybe it's contagious or something.
Yes, yes, yes. Pneumonia is actually highly contagious because it is from the air. I said that if you are able to make the air cleaner, the children may not have pneumonia. Okay, what normally happens is that if a child out of many that are in a home is having pneumonia, we don't say isolate. You try to reduce the contact as much as possible. You try to reduce close contact as much as possible. So when you reduce the close contact, the other children may not be able to get that from the person that is infected. And those that are coughing, we also teach the children, they need to cover their mouth when they are coughing so that they don't cough those bacteria, those viruses out into the air for others to breathe. They have to cough into their elbow, like we are taught during the time of COVID-19. So they have to cough into their elbow, or they have to use clothes, handkerchief, or napkins, cough into the napkins and probably wash it, or cough into tissues and throw the tissues away. So that's what you do. You reduce the contact as much as possible.
All right. Thank you, sir. Thank you. Sir. We are still waiting for your questions. I wonder why people are not asking us questions. Or is it the traffic? Lagos people.
Mm.
Is it the traffic? The traffic is too much. Don't worry, we'll be fine. So
Mm.
I'm sure most of us we have questions, and we are still taking other child-related questions aside pneumonia and diabetes. You can also ask your child-related questions. Don't think it's just we are focusing on pneumonia and diabetes today. No, you are free to ask any other question you want to ask, as long as it's child-related. The routine will still answer us today, and we have like a few more minutes left, so can take few questions before we call it a day today.
Okay, while we are waiting for the question, let me move to probably the vaccination that prevents against pneumonia, starting from the pentavalent. The pentavalent vaccine is taken at 6 weeks, 10 weeks, and 14 weeks. When the child is 6 weeks old, 10 weeks old, 14 weeks. The pentavalent has pneumococcal vaccine within it, has Haemophilus influenza B vaccine inside it. And as a result, the children are protected from getting pneumonia if they fully take all the courses, the one at 6 weeks, the one at 10 weeks, and the one at 14 weeks. If the children are given this one, they are protected. Then out of that pentavalent is what you call DPT. DPT is diphtheria, pertussis, and tetanus. The diphtheria and the pertussis, they also cause pneumonia. They cause chest infection. So if a child is immunized, the child will not come down with these diseases. In the past, children used to come down with pertussis, diphtheria. They call them the childhood killer diseases in the days that we are growing up. So we encourage our parents to make sure their children are fully immunized. Once they are fully immunized, they can keep their finger crossed that their children may not have pneumonia. Also, we have mentioned breastfeeding. Children should be fully breastfed. Then things like burning, bush burning around the houses, we should take the children away from such places, because when they inhale such, they may have the pneumonia. And we should not do self-medications. We should, if a child is confirmed to is having the symptoms that we have mentioned today of pneumonia, symptoms of fever, cough, catarrh, fast breathing, such children to be taken to the hospital, to be diagnosed and to be properly treated. So if we do all this, then the world one day we get to a state whereby we are free of pneumonia. We will not be losing any child, or children will not be dying anymore from pneumonia.
Thank you, sir. Okay, Dr. Gbemisola Boyede is greeting Dr. Rotimi and Fumi. Okay, we are also greeting you, Ma. Good evening.
Good evening, Dr. Gbemi.
So we
So,
have 15 more minutes before we go into the day. You can still
mm,
drop your questions now.
okay,
Okay.
so while we are still expecting the questions, I guess we can keep talking on these two diseases we are talking about today. So I move back to the diabetes. When we are talking about the type of diabetes, we talk about type 1 and type 2. And we said that type 1 is childhood diabetes mellitus. So, it will surprise many parents that children also have diabetes. It is true. But their own is due to their genetic predisposition. They acquire it, it is in their gene, acquire it from their parents. And many children may not manifest until maybe when they are getting to in the early stage, they may not manifest it. Maybe some, maybe from the age of 4, 5, and above, when they will start manifesting it. And such children, they also have excessive tests. All the symptoms we mentioned, they pass urine frequently than normal. They have excessive tests. They eat much more than the other people around. They have all these symptoms. They also experience tiredness, blood visions, and the rest. So all these symptoms, if our parents they notice this in any of their children, they can actually take them to their pediatrician, for screening, especially if there is family history of diabetes in such family. So they take them to pediatrician whereby they will diagnose. And we have said that children with diabetes, we are normally placed on insulin because their own is insulin dependent diabetes mellitus, the type 1, due to the defect in the production of insulin. So they are giving insulin, not the other oral hypoglycemic drugs. And they are also taught how to give this insulin. Both the children and adults are taught how to give this insulin to them, because we don't want them to be coming to hospital to take the insulin injection on daily basis. Also, one other part for our ATP family that we have not mentioned is gestational diabetes mellitus. From the world, some people don't even have diabetes at all, but once they conceive, by the time they are getting to the second trimester of the pregnancy, their sugar will start to rise. The sugar will start to appear in their urine. They develop what we call gestational diabetes mellitus. Gestational diabetes mellitus is diabetes in people who don't have the diabetes before getting pregnant, but now that they are pregnant, they are now diagnosed of diabetes. And it is as a result of some of the hormones of pregnancy that fight, some of the hormones of pregnancy that fight the insulin in the mother. And this is a very delicate condition in pregnancy, or delicate disorder in pregnancy. When it happens, many women may lose that pregnancy. Many of the pregnant women, they may lose that pregnancy. So any woman that is diagnosed of diabetes in pregnancy, to take it very seriously, they should register, in a multi-specialist center, in a teaching hospital, or a secondary facility, because they will need the care of obstetrician, they will need the care of a dietitian, they will need the care of endocrinologists, and they will also need the care of pediatrician, because many of them, they may have miscarriage as a result of the sugar if it is not controlled. Many of them may have intrauterine death. The baby may die in their womb if it is not controlled, for uncontrolled diabetes mellitus. Then many of them, they may have babies that are big, macrosomic baby. They may have baby with birth defects, with congenital abnormality. They may have baby with congenital abnormality, with birth defect. So that's why all these specialists will be involved in managing, their pregnancy. And what we also found is that many of them may lose the baby towards the end in the third trimester. So as a result, an endocrinologist is brought in to support the obstetrician, and the pediatrician is also brought in so that the woman will have a safe baby. So many of the baby may also even be delivered before term. And I must also say that gestational diabetes mellitus is associated with preterm babies too. So many of the babies may be born before time, either induced by the doctor in order to save the baby, or the mother may have it before time. And these mothers, once they deliver their babies, within 6 months, many of them return back to their pre-pregnancy state. That means they go back to non-diabetes state. So after about 6 months.
I think we have a question. Okay. Mama Kayode Agosa, well done. Thank you, thank you. Okay, Falana Taiwo is asking, I urinate frequently and my FBS is 78.
Okay, thank you for that question. Your fasting blood sugar is 78, meaning that you are not diabetic. Even though you can still do urinalysis to be sure that there is no sugar in your urine. But the causes of frequent urination are many. There are some people, they are psychogenic drinkers. They drink water, they just want to drink water on their own. They take plenty of water. So they are also likely to pass plenty of water in their urine. Then during cold season, like the rainy period or when the weather is cold, there is likelihood that we also urinate frequently, because the weather is cold, you won't have ability to sweat a part of the water away from your body. So you may also urinate frequently. Also, if Taiwo is a guy, is a man, if Taiwo is a man, for men, when they have prostate issue, they may also have frequent urination. But for either men or women, for if there is urinary tract infection, they may also have frequent urination. So it's not only sugar. Urinary tract infection is also a cause of frequent urination. And there's something we also call diabetes insipidus, which comes from the brain. you know, Diabetes insipidus. This could also make the person to pass urine frequently. So there are many causes of frequent urination. We must commend Taiwo. Taiwo has taken step ahead to do the fasting blood sugar. So Taiwo is not having diabetes. So the frequent urination could be from the other things that we have mentioned.
Okay, Queenie Michael is saying, well done, well done, work doctors. I'm watching from Nasarawa. Okay, Queenie Michael, we're so happy to have you join us today. I hope you've learned one or two. Okay, another question here. Okay, will the insulin be given to the child for life or for some times?
Okay, the problem is with insulin production. The problem is actually with insulin production. So many of the children with childhood diabetes mellitus are put on insulin for life, because there is nothing producing that insulin in the body. Even though these days there may be newer technologies, with the help of a pediatric endocrinologist, there may be a supportive treatment. But insulin is normally is for life, because there is nothing producing that insulin in the children.
I hope that answers your question, ma'am. So, Dr. Rotimi said the insulin will be given for life. So, we still have few minutes to take one or two.
Yes, truly. Also, there are times that they may have break if their sugar is controlled at certain particular point in time. The insulin level may also be reduced, depending on what their sugar level are.
All right. So, before we call it today, we are still here answering your questions.
Okay, for our women too, for the ATP family, where we have many women, as followers, members, and volunteers. On the ATP family, for women that have diabetes mellitus, they can also present with frequent infections in the body, like
Exactly.
having
That's what
frequent boil. Yes,
Falana just
somebody keep,
replied now that
yes,
I was told my frequent urinating would be an infection.
yes. What I'm even saying now is that diabetes could also cause frequent infection. For those that have diabetes, they will have a recurrent vaginal discharge. They keep having candidiasis repeatedly. They keep having boil in their armpits, boil in several parts of their body. The infection will just keep coming back as a result of diabetes mellitus that they are having. So in some cases, so especially women that are having candidiasis almost every now and then, they need to also get their sugar done. It could be as a result of the diabetes mellitus. They are having the frequent infection.
Okay, okay. Now another question. What happens, as much as we keep enlightening mothers, some still probably rely on self-medication or maybe let me say I don't care. So what happens if pneumonia is left untreated in the body for a long time?
Okay, especially for our children, we mentioned it earlier, there'll be complications. If the pneumonia is not treated and the body immunity cannot overcome it, that pneumonia will get to a stage that we call severe pneumonia. And this severe pneumonia will lead to complication of the heart, which we call heart failure. And if that is not taken care of, the child may definitely die from that heart failure. So pneumonia should not be left untreated. It can lead to heart failure, and the child can die as a result of that. So any child with pneumonia should be taken to the hospital to start medication. Even in the communities where there are no doctors, they have been taught how the type of drug to administer, under the care guidance of superior health officers, drugs to administer so that such children will not get to the stage of the complication. So pneumonia should never be left untreated. If left untreated, it could lead to the death of such children.
Okay, okay. So I think we've heard that now. No disease whatsoever should be left untreated. I think we should note that we should not focus on pneumonia or probably diabetes alone. We should not rely on self-medication when it comes to illness, both adults and children. So we should learn to take care of our health. So I think we can take one more question. We have like 3 more minutes thereabouts. And in the absence of any question, we can call it a day. So, okay, we have a question. My sugar level is 102 and I still feel weak. Please, what could be the cause of it?
Okay, your sugar level is 102. We say when the sugar is between 100 and 125, that's pre-diabetes. You have to watch it so that it not keep going up, but try to control what you eat so that it will fall within the normal range of 100. Yes, weakness could be from several reasons. Weakness could be from malaria, weakness could be from exhaustion, weakness could be from any of the diseases. It could be from even when you are overwork yourself. So weakness could be from all such. If your sugar level is 102, the other test could help to confirm if you are pre-diabetic. But 102 is pre-diabetes. You are not diabetic. Just work on your diet, but the weakness, try to find out the cause of the weakness by probably seeing doctors or doing more tests, malaria tests, simple things like that. They're trying to take rest.
Okay, I hope we have answered your question now. Yeah, yes. So, at this junction, we can actually call it a day now. Yeah, because it's already 7 o'clock. So, Dr. Rotimi, any final word before we call it
Okay,
a day?
well, I would like to thank all our members, our listeners, the viewers, those that are also watching us on the several platforms for being part of our celebration of World Diabetes Day today and also the World Pneumonia Day. It's a two-in-one package. I want to thank everyone for being part of ATP Life and also want to encourage us. Let's keep a date next week. Dr. Gbemisola Boyede will be with us next week, same time, same channels, over all our channels. Thank you.
All right. So thank you, Dorothy. Thank you so much for saving day. Like that's what I'll call it now. You really saved the day. So thank you so much for being our host today. And till we come your way again next week, same place, same time. Please live healthy. Take all complaints to the hospital. Don't assume and don't self-medicate. I wish us all a wonderful week ahead. Bye.
Bye.